Hello, I'm Dr. Lonnie Herman, and welcome back again to another video here. This one will be very brief. Another video about chronic infection that can occur inside the intestines. I want to be careful and help you understand something. The intestines are not the only place where the infections can occur. Infections can occur in your pancreas. They can occur in your spleen. They could occur in your liver. They can occur in the kidneys. They can occur in the bloodstream. Okay? So we want to be careful. I want to be careful here and make sure you understand it's not just the intestines, but one thing that we can do for you is run a laboratory. There is a great poop test, a stool test, that's a DNA analysis with this lab called Metametrix. It's a 2105 DNA stool test. And this one will tell us in the large intestine, do you have infections? Do you have any viruses? Do you have any fungus? Do you have any yeast in there that doesn't belong there? Do you have a good gut flora? It will measure the amount of the different bacteria and tell us exactly which ones are high and low or normal. So that test is one of my favorites because it gives us so much information, and it's a very sensitive test. It's 98% accurate. Some stool tests that are offered in hospitals or other labs are not very accurate because they only find if there's a moderately high to high called severe infection. And sometimes you can have an infection, let's say severe is 10,000 bugs and eggs in the body. What if you have 500 and they can't find it? If they have 500, if you have 500 and they can't find it with that lab, you're going around saying, well, I'm sick, I don't know why, and no doctor can answer my question, why am I still feeling this way? Well, we can use this lab because it will find even if there's one egg in your intestines or one bug in the intestines. But there's also another skill that I've learned, that I've developed in the past year here in practice, is kinesiology. We can actually find if you have an infection in these different organs and exactly which type of natural medicine, not medicine, pharmaceutical grade drugs, but natural supplements that can actually counteract that infection in the body. We can figure out exactly what species of infection, and we can figure out exactly what needs to be used that your body will like to counteract that infection. It's very interesting, the kinesiology work that I do, very interesting. But I'd like to blend both the Western science philosophy, the lab, and the Eastern science. You know, people are coming into my practice who've already been to other doctors and hospitals with their chronic condition, and they're so set in, I need to see what the lab shows. Well, there are some skills that I've developed I can prove to you and show you that we can point out exactly when there is a problem that even the lab may not be able to show you. And that's what I had to do, not only learning immunology blood labs and stool testing and urine testing and saliva testing. Not everybody got better just by running those labs. I had to develop other skills. So if you look at something like acupuncture, and that's not what I do, but looking at acupuncture, it's been around for over 4,500 years. Obviously, there must be some validity to it, because if it had no effect in positive for any human being, it wouldn't still exist, right? So there's other things, other ways of practicing that are available for you to get better or your loved one to get better that you just have not experienced yet, and you've got to be open-minded. Okay, let's look at some pictures here. Look at this. Now, I found these slides on the internet. This is a chronic candida infection in the intestines. We'll go more into what candida really is in another video, but look at that. Slimy, white, sticky stuff on the intestinal wall. That doesn't look too good to you, does it? That's going to hurt. That's not going to be, you're not going to have good digestion with that. And you can have inflammation anywhere in the body. This is ulcerative colitis. Look at this. Not pretty. This is an H. pylori organism. Look at this little fella. This can be in the stomach. It can be in the bloodstream. It could be in your pancreas and not even be in the intestines. It could be in the stomach. It could be, as I said that before, it could be in the intestines. It could be in the kidney. It could be in the pancreas. It could be in the bloodstream going up to your brain, to your heart. This can lead to hardening of the arteries. This can lead to stroke and heart disease. This can lead to pain with digestion. This hookworm, look at this one, that big smile on him, 2 eyes and big teeth there. This could be in your tissues and not even exist in a stool test. Maybe they won't find this in a poop test that they did in the hospital. Maybe this is sitting in your liver. Maybe this is sitting in your blood vessel going up to your brain. That's a possibility. We've got to look in the right places and use the right methods to figure things out, okay? So these are not pretty, but I've seen many people in my practice who have these kinds of infections, and this can relate to all different systemic disorders like yours. All right? So again, There's a 2105 DNA stool test, and there's kinesiology that we use. And then once we find out what it is, then we can figure out exactly what it takes to kill the bugger inside, wherever it is, and detoxify your body and make you healthier again. And that way you can feel better. Okay? Thank you for letting me share this information with you, and I look forward to sharing more information with you on all the upcoming videos.